Jim, I know last week you watched this along with us. William Kuhn, he made an impact on so many of you watching, so many viewers last week. We showed you his plea for a vaccine, like many other Hoosiers who are so medically vulnerable. If they get COVID, they've been told they will die or likely die. So for him, he had questions. I went to the governor. I went to the Department of Health with 3 requests, but no one would come on the show to talk about vaccine distribution and when William and many of others like you will be eligible to get a shot. But when I reached out to Homeland Security, which I was also told to go to, trying to get answers, they put me in touch with Indiana EMS Medical Director, Dr. Michael Kaufman, who's going to talk to us about another part of the program. Dr. Kaufman, so good to see you.
Hey, hi, good morning, Angela.
Hey, I know you're not here to talk about the other part, but that has been such a big frustration for those watching, and they were hoping that this part of my segment today would be answering their questions on the medically vulnerable. But I want to talk to you about something that you have really spearheaded, and is getting the shots to people who are homebound, still 60 and older. How have you been able to do that, and what is that program all about?
Yeah, thanks for asking, Angela. This is a wonderful program. It's called our Homebound Hoosier Program, and it really is a collaborative effort involving the Indiana Family Social Services Administration, Department of Homeland Security, the Department of Health, local public health departments, and then local EMS and fire-based agencies that are really available in every city, every area around our state. Let me tell you just a little bit more about that. At its core, our Homebound Hoosier Program is designed to get COVID-19 vaccine to Hoosiers that, like the story you mentioned, that would otherwise not have access to this life-saving treatment. It matches available vaccine from local health departments with identified homebound individuals in those areas, and then utilizes local assets, local EMS fire agencies in those communities to deliver and administer the vaccines. It's really a perfect partnership of public health and public safety to deliver non-emergent care in place to persons in their communities in an effort to improve personal health and safety. So we're really excited about the program.
Yeah, I was talking to William's mom last week, and she is very hopeful that when William can get a shot, that this kind of a program, she didn't really know at the time, would she have to go somewhere, but when he's, in that age group that can get a shot, that he'll be able to have the shot and won't have to go out to the public. How many people have you helped so far?
Well, EMS has been involved really from the beginning of the pandemic, trying to help folks in their communities, whether that's through responding to 911 calls for help, testing, or in this case now, administering, delivering vaccine. We know that that EMS providers across the state have delivered vaccines to homes probably more than 200 times, but there's so much more need. We've got well over 1,200 folks now registered within the Homebound Hoosier portal. Vaccine supply still seems to be our #1 constraint, but as new vaccines are gaining approval, as more vaccine is becoming available from those that are already authorized for emergency use, we think it's just a matter of time before more and more Hoosiers are able to get a home vaccine delivered by their local EMS agency.
Yeah, there's so many people that, we've heard so much about teachers wanting to get the shot, those that are so sick that they can't leave their home to get the shot. Other people asking, and again, this is just an opinion for you because you deal with this sort of thing every day. People have said, Angela, can I give my shot to William? We know that that would probably open up all kinds of craziness and being able to try to figure that out. But we had men and women who are over 70 saying, please, can I give my shot to him? I want him to be able to leave his home. What do you tell people that want to be able to give their vaccine, and how hard that would be to even figure out how to do something like that?
Yeah, Angela, the logistics around these vaccines are just incredibly challenging. As you know, these are very effective vaccines, but because of the distribution, the storage requirements that are really unique to these, it presents a challenge. I do have to give very big kudos to Dr. Box and her team at the Department of Health. I think Indiana has done a tremendous job at allocating vaccine and getting it out to Hoosiers. In just a couple short days, we'll have over 1 million doses of vaccine delivered to Hoosiers, and that's just unbelievable, especially when you compare that to other states that have just had exceeding logistic challenges in getting this done.
Yeah, we know that there are more people who are over a certain age who have died and that are very vulnerable, so we understand why those folks should get the shot too, but it's just so many people have questions. Dr. Kaufman, we appreciate it. We'll link people up to more information on the Homebound program. Great job on helping that come to fruition.
Thanks, Angela. I really appreciate that.
You're welcome.